We begin with a national story. Adults who want to use a mental illness as the sole basis for a legally assisted death will likely have to wait at least another 3 years. Federal Health Minister Mark Holland introduced legislation that, if passed, would postpone the government's plan to expand the medical assistance in dying program until March 2027. Adam Atkinson joins us live in studio with the details. Good evening, Adam.
Thanks, Matt. This move won't affect a lot of Canadians, but there are some who are struggling with severe mental disorders and are treatment resistant, and they were looking forward to applying for the medical assistance in dying program.
We understand that this is a deeply personal topic and an issue that may be challenging for some. We're also aware that many Canadians hold strong opinions about this issue, and that there has been much misinformation about this that has impacted on public discourse.
Independent Canadian Senator Stanley Kutcher from Nova Scotia says the joint committee he sat on failed Canadians.
We think that the committee failed to respect its mandate. It failed to accurately represent the weight of witness testimony, and ultimately, it failed to uphold the Charter of Rights of all Canadians.
Federal Health Minister Mark Holland introduced legislation that, if passed, would postpone the government's plan to expand the medical assistance in dying program for another 3 years. The CEO of Dying with Dignity Canada says people struggling with untreatable mental disorders have already waited long enough.
Yeah, we were certainly disheartened and I think discouraged, particularly on the part of that very small group of individuals who have been waiting to access MAiD under the sole underlying condition of a mental disorder.
Helen Long says there are very few Canadians who would even qualify for the MAiD program.
We know from the evidence in Belgium, where this has been legal for 20 years, that we're talking about a very small number of people who have a long history, years, if not decades, of mental disorder that has not responded to treatment.
And Long suspects that this news is devastating for those people.
Last time, there were at least 3 individuals that we're aware of who did die by suicide following the announcement because they entered a state of crisis and were unable or unwilling to find support. So we're obviously deeply concerned about that as a possibility yet again.
The expansion of the program to patients with mental disorders will be delayed until at least March of 2027. Mental health experts say if you are struggling with mental health and thinking about suicide, call 911 or go to the nearest hospital.